Competence is a combination of passion and skill. To bring out passion, we must nurture an environment where people feel successful, and the biggest deterrent to a personal sense of success is trust. Arthur Karmazi, a pleasant day to everyone. We're the third year students from BSN 3B Group 1A presenting to you a research study entitled Level of Competence in Operating Room Procedures Among Fourth Year Nursing Students. I am Kaye Angelica Balao, and together with me are my group mates Emman, Noel, Antipatia, Jamiel James Arceno, Star Arricivita, and Khylle. So the study aimed to determine the level of competence in operating room procedures among fourth-year nursing students. Specifically, it sought to answer the following questions. First, what is the demographic profile of fourth-year nursing students in terms of sex, section, and first sem med-surg hourly grades? Second, what is the level of competence of fourth-year nursing students in terms of knowledge, skills, and attitude? And lastly, is there a significant relationship between the level of competence and profile variables?
In research design, the study used a descriptive quantitative design. For our participants, section A to G using Sylvan's formula, a 5% of margin of error, 160 students was utilized in the study from the total population of 271. So our sample size is 160 participants. For the research instrument, a researcher-made instrument will consist of two parts. Part 1 will be the demographic profile of the participants. Part 2 will be the performance evaluation. For the validity, the researchers asked 3 professionals with a master's degree in nursing who have experience in research, and the instrument garnered a mean of 4.61. For the reliability, the research asked at least 23 participants to answer the instrument, and the answers with regards to knowledge, skills, and attitude were tested using convex alpha with a result of 0.89.
For the results and discussion, Table 1, the demographic profile of sex reveals that the majority of the participants, 70%, were female. Out of 160 participants that were from the different sections, each has a percentage between 13.8% to 15%. Next, for the first semester med-surg RLA grade, it has shown that the majority of the participants were excellent, with the equivalent of 57.5% out of 100%. 46 out of 160 participants belonged to excellent, 21 out of 160 then belonged to good, while only one was in the satisfactory. For the second table, it details the overall level of competence in terms of knowledge, skills, and attitude of fourth year nursing students. Knowledge has a mean of 2.60 with verbal interpretation of very high, skills has a mean of 2.65 with verbal interpretation also very high, attitude has a mean of 2.72 with verbal interpretation also very high. Lastly, there is no significant relationship between the level of competence of fourth year nursing students in terms of sex, section, and med-surg first sem RLA grades. Therefore, the null hypothesis is not rejected at 5% level of significance. The results indicate that the profile variables of the respondents are not an indicator of their level of competence.
Continuing on, the study indicated that the students' profile features were not reliable evidence of their degree of competence, implying that parameters such as age, gender, and educational background do not always correlate with professional skills or competence. These findings call into question frequently held perceptions about the relationship between personal qualities and professional competency, and they suggest that other elements such as clinical experience and training is more important than defining the degree of competence. The evidence also suggests that evaluating nursing students based on their specialized skills and expertise rather than their personal characteristics may be more beneficial. For example, two people with comparable profiles may have quite different levels of competence based on their clinical experience or training. As a result, schools and organizations attempting to establish more effective ways for evaluating student performance and potential may need to investigate alternate techniques that place a greater emphasis on objective measurements of performance rather than subjective assessments based on personal traits.
After the results of the experimentation, the following recommendations have been prepared by the researchers for the improvement of the study. Number 1, nursing schools should continue to provide training and education on operating room procedures to ensure that nursing students are competent in this area, including hands-on simulation with real-life scenarios that student nurses can practice their critical thinking skills on. Number 2, nursing schools should also consider incorporating more practical and hands-on training in their curriculum to improve nursing student skills and competence. Number 3, Emphasize the importance of teamwork and effective communication among surgical members, as this will greatly impact the success of procedures. Number 4, encourage regular self reflection and evaluation of personal strengths and areas for improvement to foster ongoing professional growth and development. Number 5, further research could be conducted to identify other factors that may affect nursing students' level of competence in operating room procedures. Number 6, the findings suggest that nursing students' demographic profiles are not significant indicators of their level of competence. Number 7, future research could explore the effectiveness of different teaching methods and strategies in enhancing nursing students' level of competence in operating room procedures. And that concludes our research study. Thank you.